Efforts to reduce toxic, cancer-causing gas emissions across the country were dealt a setback this month when the White House granted exemptions to new clean air rules for dozens of commercial sterilization facilities.
Public health experts call it a dangerous game that threatens the health of nearby communities, but the White House says it's necessary to protect national security. Spotlight on American National Investigative Correspondent Angie Moreski looks at the impact of this major move to delay new clean air rules.
An estimated 13 million people nationwide live within 5 miles of commercial sterilization facilities that use ethylene oxide, or ETO, a toxic invisible gas used to sterilize medical equipment.
They're all around the country.
Marvin Brown, senior attorney at Earth Justice, is worried about the public health implications of pausing these regulations impacting so many people.
The effect of this is going to be to put people's health at risk.
ETO was classified by the Environmental Protection Agency as a carcinogen nearly a decade ago. It's been linked to multiple cancers, including leukemia, lymphoma, and breast cancer.
We are breathing a deadly carcinogen.
After years of community outcry about elevated cancer risks,
we are sick and we are dying,
documented by Spotlight on America, the agency finalized tougher rules in 2024, requiring facilities to reduce ETO emissions by 90%. But now, just over a year later, the White House has granted a 2-year exemption for those new regulations to nearly half of all commercial sterilizers nationwide. Is this unprecedented?
Incredibly unprecedented. The administration has used this authority for the very first time in the history of the Clean Air Act.
The proclamation says exemptions were granted because the technology to implement the ETO rule is not available, that the current compliance timeline will likely force existing sterilization facilities to close down, seriously disrupting the supply of medical equipment, and it says, as a result, undermine our national security.
Of these facilities, 7 appear to already meet the emission standards.
But Brown says the White House reasons defy logic because several facilities have already installed the very equipment needed to reduce emissions. So they're already doing it.
They're already doing it. EPA knows it can be done.
There's also a lingering question about transparency on why these specific exemptions were granted. Spotlight on America submitted public records requests to both the White House and EPA to get more information on the criteria, but we have yet to get answers. Does the public have a right to know that information?
100%.
Of the 40 facilities granted exemptions, 16 were on the EPA's high-risk list for ETO put out in 2022, which Brown says creates even more concern.
Rolling back health protections is not making anyone healthy. The administration is playing a dangerous game of chicken.
The American Chemistry Council, which represents several impacted companies, praised the exemptions, calling the tougher rules an overreaching regulatory measure, which they say didn't take into account meaningful progress to reduce ETO emissions over the past several years. But when we asked them for an interview to discuss that progress, they declined. For Spotlight on America, I'm Angie Moreski.